Okay, Navin, we'll move on to WBC count,
Yes,
okay,
ma'am.
which is another major experiment. What is the name of the diluting fluid used here?
Mm, Turk, Turk's fluid, ma'am.
Turk's fluid. Good. You should not pronounce it as Turkey fluid, Turkey fluid, okay?
Yes,
So
ma'am.
it is Turk's fluid. What is the composition of Turk's fluid?
So 1% glacial acetic acid,
Genesian
Genesian violet. Gentian violet, ma'am.
Gentian violet.
Okay,
That's
gentian
what I
violet.
wanted to emphasize. It should not be pronounced as genitan
Okay,
violet or Genesian blue. Different colors students used to say it is
okay.
only Gentian
Gentian violet.
violet.
Yes, ma'am.
Okay. Then
Then distilled
distilled
water.
water. What is the purpose of glacial acetic acid?
So it lyses the RBCs, ma'am.
Okay. Why should it be lysed?
So RBCs are naturally colored cells, which might hinder the counting of the WBCs, ma'am.
Okay. Then what is the purpose of Gentian violet?
So it stains the WBCs, ma'am.
Which part of the WBC is getting stained?
Nucleus.
Yes. Good. Okay. So what is the dilution factor here?
So the dilution factor in WBC is 1 in 20, ma'am.
Okay.
So the blood is drawn up to 0.5 and the dilution fluid till 11. So the dilution takes part in the bulk portion whose volume is 10. So the 10 part of the diluting fluid contains 0.5 part of the blood. So the 0.5, the dilution is 0.5 and 10. So thereby 1 in 20, ma'am.
Okay. So now that you have diluted the blood, okay, it is ready now. Okay. So how will you, what is the next step?
So discard some part of the blood and will
To
be
remove the stem fluid. Okay.
and will
Then
be charging in the
you will be charging under the cover slip. Now the cells will be settled in the U bar
entire rolling.
ruling.
Yes,
Where
ma'am.
is the WBC square?
It's present in the four corners. Big squares will be there. Four
Okay.
big squares,
Okay.
and each big square is divided into 16 small squares, ma'am.
Okay. Fine. So you will be counting the number of cells in all the four corner big squares and you will be getting one wholesome number as En.
Yes, ma'am.
Right. Now the pipette, WBC pipette, how will you identify it?
By the markings 0.5, 1, and 11,
Okay.
and the white bead will be there, ma'am, and there will be white pore and white mouthpiece will be there, ma'am.
Okay. Fine. So everything is ready. The counting, the number of cells are also ready. Now you'll have to do the calculation stepwise manner. That is very important. Examiner will definitely expect the stepwise calculation. I repeated the same in RBC count
Yes,
also. Right? Okay. So final number you have got and you should express the result as say
cells per
6,000 cells per
cubic
cubic
millimeter.
millimeter.
Yes, ma'am.
Right. What is a normal WBC count?
It ranges between 4,000 to 11,000 cells per cubic millimeter, ma'am.
Okay, fine. This is in adults or in children?
In adults, ma'am.
Okay, in children
It will be higher, ma'am.
it will be higher. Okay. Any idea which cell, which type of WBC is higher in children?
Lymphocytes?
Yes, very good. Okay. What is increase in WBC count called?
Leukocytosis.
Okay, very good. So if the cells are more than 11,000, we call it as leukocytosis.
Yes, ma'am.
Can you tell me some conditions for leukocytosis?
Physiologically, newborns, pregnancies, and after food, okay, after any physical exercise,
Okay.
menstruation.
Okay.
Yes, ma'am.
Pathologically?
Any sepsis.
Okay.
Mm,
Remember, acute bacterial infection, always the
neutrophilia.
WBCs, especially the neutrophils will
Neutrophilia.
be increasing. Okay.
Chronic inflammation, there will be leukocytosis, ma'am. And
Specifically lymphocyte.
lymphocytes.
Okay.
And eosinophilia will be seen in parasitic infections.
Okay, fine.
And sepsis, burns.
Okay, fine. Okay. What is decrease in WBC count called?
Leukocytopenia.
Okay. Can you tell some conditions for this?
Physiologically, we could see it in cold extremities, ma'am. Pathologically, typhoid fever.
Very good. This is the examiner's choice of question.
Yes,
which infection you get decrease in WBC count? It is enteric fever by
yes,
typhoid and even paratyphoid also will cause decrease in WBCs. Okay, fine.
Aplastic anemia.
Okay.
And overt sepsis.
Okay, so all the WBCs will be consumed,
Yes,
so
ma'am.
it shows less count in sepsis.
Yes, ma'am.
Okay, fine. What is leukemia?
Leukemia is the cancerous condition of the bone marrow, which
Mm,
results in increase in WBC. In
okay,
in this, we'll be seeing more number of blast cells, that is immature cells, ma'am, and the count will be much more higher, like in lakhs.
okay. So that is the difference between the leukocytosis and
And
leukemia.
yes, ma'am.
Both are increase in WBCs, but what is the functional point is in leukocytosis, all the cells will be functionally
Functionally active.
effective,
Yes, ma'am.
whereas in leukemia, they are not capable of doing their functions of phagocytosis
Yes,
and
ma'am.
other things because they are immature
Immature.
and blastic
Yes,
in
ma'am.
nature. Okay, Naveen, now that you have answered all the questions in WBCs,
Yes, ma'am.
here comes your star question. Okay, what is shift leukocytosis?
Shift leukocytosis. I think it's seen in exercise, ma'am.
Okay, yes, agreed.
Mm, no idea.
Okay, I'll tell you. In exercise, what happens is that circulation becomes hyperdynamic.
Mm.
Okay, so what happens? It disrupts all the marginated leukocytes which
Mm.
is just present in the endothelial side.
Mm.
They will all enter into the circulation.
Okay.
So when you draw blood from in that situation, what happens? It seems like it is there are more WBCs.
Oh, but it's not actual
It's not
leukocytes.
actual
Okay.
increase in production. It's just relative increase in the
Okay, ma'am.
WBCs. Okay,
Yes,
so
ma'am.
that is called as shift leukocytosis. Okay.
Yes, ma'am.